Hi everyone, it's Jasmine and today's video is about glaucoma and learning lots about the disease. So I hope you learned something today and let's get started. Now, what is glaucoma? Glaucoma is a group of eye diseases that damage the optic nerve. It's often caused by increased pressure inside of the eye, and if it's left untreated, it can lead to permanent vision loss or blindness. Now, the optic nerve sends visual information from the eye to the brain for us to be able to perceive our surroundings. When there's high eye pressure, the optic nerve is damaged over time, and damage usually starts with peripheral vision, meaning your side vision. Now, this pressure inside the eye is actually called intraocular pressure, and what happens is the eye constantly produces a fluid called aqueous humor. This fluid normally drains out through a tiny drainage system, but when drainage is too slow or if it's blocked, fluid builds up inside the eye, which increases the intraocular pressure. High pressure again can compress and damage the optic nerve over time, and it can lead to vision loss. So, as you might assume, the way that we can prevent and reduce our risk for glaucoma is by managing our intraocular pressure and making sure this pressure is not building up over time. Glaucoma is one of the leading causes of blindness worldwide, and vision loss from glaucoma is unfortunately irreversible entirely. Early detection, again, can slow or prevent further damage, so that's very important if we understand how do we reduce our risk for developing glaucoma by addressing risk factors. There are different types of glaucoma, so there's open angle, which is the most common. Angle closure is less common and it can happen suddenly. And then there's other types such as normal tension or congenital, so coming from birth, increasing your risk for glaucoma. Now, if we talk about the pressure in the eye, it can help us understand the different types of glaucoma. So, for open angle glaucoma, it's when the drainage is very slow inside the eye. And for angle closure glaucoma, it's when all of a sudden the drainage is blocked and that pressure really builds up inside the eye, causing glaucoma. Now, finally, what are our risk factors for glaucoma? So, unfortunately, the risk increases with age, and it can be especially common over the years of 40 years old. If you have a family history of glaucoma, it does raise your chance of acquiring the disease later in life. And then other risks can include diabetes, high eye pressure or blood pressure, and certain ethnic backgrounds. Now, early glaucoma often has no symptoms, and gradual loss of side vision, peripheral vision, may go unnoticed. Sudden eye pain, blurred vision, seeing halos, or feeling significantly nauseous may signal an emergency, and you should dial 911 or be taken to your nearest emergency department for this to be addressed. Again, these sudden symptoms may indicate closed angle glaucoma, which we talked about a little bit earlier, that can come on suddenly. If you are seen by a physician or a doctor, how glaucoma is diagnosed is typically through eye exams, so going to an optometrist to have your eye pressure and your optic nerve health measured. Doing visual field tests, so seeing if you can see things that are in your peripheral vision or if your peripheral vision has been affected. And making sure that we're having regular eye exams to detect glaucoma earlier can guarantee better outcomes for yourself. Now, while glaucoma, if you're diagnosed with it, is a lifelong journey, there are treatment options for these symptoms. So, again, there's no cure, but eye drops are commonly prescribed to lower the eye pressure, And there's different types of surgery, such as laser therapy, that can be used in some cases. Now, we talked about the risk factors that increase our risk for developing glaucoma, but what preventative practices can we take now to make sure that we are reducing our risk for developing the disease? So, again, getting regular eye exams is crucial, especially after the age of 40. Knowing your family history can give you a better understanding if you're at an increased risk for developing glaucoma. Managing diabetes and blood pressure. So, if you've ever been told that you have high blood pressure or hypertension, making sure you know what that means and what lifestyle behaviors you should be following to manage these chronic diseases. This may include exercising regularly, avoiding smoking, taking medications properly, and so on. Another way to reduce our risk for glaucoma is protecting our eyes. This can include simply wearing sunglasses when you go outside. And then finally, if ever prescribed eye drops, use them as directed to make sure we're taking care of the health of our eyes properly. Glaucoma is a leading cause of irreversible vision loss, often developing without early symptoms. Regular eye exams, awareness of personal risk factors, and early treatment are essential to protecting vision. By recognizing the importance of prevention and timely care, vision loss from glaucoma can often be slowed or even prevented. Thanks for watching.